today I want to talk to you about vaccination, and the first thing I want to say is that Quebec vaccination will start as soon as we receive the first doses. That's important. Federal government announced that Pfizer will be available as early next week. Of those 4,000 doses, that means that we will receive those 4 boxes, and those 4 boxes will allow us to vaccinate 2,000 people in as of Monday next week, which is December the 14th. They will be deployed in 2 CHSLD, so that's really our first test. That's important. But between December 21st and January 4th, we will be able to receive approximately 57 of those boxes from Pfizer. And those 57 boxes will allow us to vaccinate approximately between 22 and 28,000 people in those 2 weeks, which is a good number. I think I want also to reassure Quebecers that given the good experience that we have with the vaccination of influenza, we have vaccinated in the last month over 1.1 million people. And especially in the last week, we have been able to vaccinate 250,000 people per week. So this is a good number. And the number of vaccine that we expect to have in the first quarter or 2021 would need to vaccinate about 100,000 persons per week. So we can do that easily because we can do right now with our staff 250,000 per week. The second thing that's important today that our experts have presented with Richard this morning, the summary of who should be vaccinated in order of priority. And this has been presented by and is a recommendation of le Comité d'immunisation du Québec qu'on appelle le SIC. Fait drôle en anglais. It's a bit strange, but that's the way they call it. But these groups have determined that the order of priority, and I won't go into the details, but we agree with those recommendations. And we will, over the next few weeks, adjust to the priority as to how we follow their rules, but also that we adjust to the geography and the mechanics of Quebec to make sure that we do that properly. So I would like to end this message to Quebecers that we see the finish line of this marathon, but at the same time, I don't want to lose focus on what we have to do in the next few weeks, because what I think is important is we see the vaccine that can start next week, but people will continue to be sick over the next few months. We have an increase of 40 hospitalization today, 40. So it means that 80 people got entered in the hospital today, and only 40 got out. So we added another net of 40 today. And we'll see this number increase in the next few weeks because of the number of cases that have been increasing. So there is some good news, but we don't want to lose focus. So let's take the good news. But I'm asking Quebecers, and I remind them to continue to follow the rules, and I'll be glad to answer a question. Thank you. Good.
Okay. I know it's a bit down the road, obviously, but the sort of the I guess the second or third group of people who will be getting the vaccination, people who have underlying health issues, how will that work out? How would someone who's a cancer survivor or has diabetes or whatever, how would they go about getting proof that they are able to get that vaccine in the second batch, I guess you can call it, of people?
Michel?
Well, we are not going to use a registry of people that have chronic disease, but the first groups that we are going to offer vaccine is people by age, and that's easy because it's on the Medicare card, so it's quite easy to monitor. But after that, we'll have close to half the population that already will have had the vaccine, and I think people come in and that's fine. We don't have any problem. We need to remark also that chronic disease and age are also closely related.
My first question is about kind of relating to Jay's question, but about the second and third groups and going on. When it gets to the mass population, considering what we saw with contact tracing and people, for instance, not picking up their phones, not getting back to people, how exactly what's your message to Quebecers about how this is going to work and how reliable it is based on what we saw with contact tracing?
Well, people will have to reserve their place to be immunized. So there will be a way that people will get in touch with the system and ask to be immunized. And once they get the first shot, then they are in the registry and they will have called back. And as we have said, the interest of people in being immunized is quite high. I won't repeat the figures that we just said before, but that means that we expect that people will go for the second shot, and that's important. It's a very important message because the data that we have right now, it really takes the 2 shots to be very effective. So that's an important message. Yes, we've had difficulties with people not to answer the phone calls because they didn't want to be bothered, but they didn't want to be pointed as, the people that might have transmit the disease, which is completely different for vaccination. We are offering a protection for other persons.